Hello, anatomy colleagues. This is Dr. Alsop, and in this first video regarding joints, we're going to focus on the basics, and then we'll get a little bit into the different types of joint classifications. And there's lots of different schemes. We're going to focus in on a few. All right, we have 4 learning objectives for this video. So keep these in mind as we discuss. And at the end, the goal is that you're able to answer these in your own words. So let's start with the most basic of basics, and that is defining what a joint is. And it's pretty simple. A joint is any point where 2 bones meet. And sometimes a joint is referred to as an articulation. In fact, you'll often hear me use the term articulation. And there are so many different ways to classify a joint, and these classifications are typically discipline specific. So, say a kinesiologist may classify a joint differently than an orthopedic surgeon, and they both may classify differently from an anatomist like me. And as you might imagine, we're going to focus on anatomical classifications, which even there are some differences between sources. Classification schemes can typically be broken into structural classifications. So, what is the joint composed of, or what tissues are actually connecting the bones? This is where we are going to focus. But I did want to note that joints can also be classified functionally. In other words, how much movement is allowed at a joint. So, some joints allow no movement at all. Some allow slight movement, and some joints are freely movable. But as I mentioned, we're going to focus in on these structural classifications. And these are based on 2 things. First, is there a space between the articulating bones, or are the bones connected by a solid sheet of connective tissue? The space that we're referring to is called a synovial cavity. So if there is a synovial cavity, you know you're talking about a synovial joint. If it's connected by a solid sheet of connective tissue, then we need to consider the types of connective tissue that's holding the bones together, which we'll talk a bit about more in the next slide. But I want to focus in on this concept here, which is bones never actually touch in almost all joints. There will always be connective tissue between the bones or space, and that connective tissue is what's connecting the bones. Bone-on-bone contact is actually bad. That can be pathological. So the 3 types of structural joints are fibrous joints. Fibrous joints have bones connected by a solid sheet of dense, irregular connective tissue, and there is no synovial cavity. So, an example of a fibrous joint are the sutures in the skull. There are also cartilaginous joints. These do not have a synovial cavity either, and the bones are going to be connected by a solid sheet of cartilage, as its name would suggest. And lastly, and the most numerous type of joints are going to be synovial joints, and we will spend a lot of our time discussing synovial joints. The bones are connected on the sides by dense connective tissue in a more sleeve-like manner. There's not a solid sheet of connective tissue between the bones because there is going to be a space between the bones, and that is that synovial cavity. So this is why synovial joints are going to be freely movable. Now, I made a big point to note that bone should never touch bone. There should always be connective tissue in between, but you may hear the classification of a synostosis or a bony joint. And what happens here is the gap between the bones will become fully ossified, so the connective tissue connecting the bones is fully replaced by bone. So what was once 2 bones are joined at a joint to become 1 bone, and that's a synostosis. So an excellent example of this is the frontal bone. So you're going to have the right, at the beginning, you're going to have a right and a left frontal bone. So you'll have two different frontal bones. They will fuse early on, so you'll completely lose this connective tissue in between. It'll be fully replaced by bone to have the one frontal bone that you have in an adult skeleton. So that's an example of a synostosis. Another example includes when a diaphysis and the epiphysis will fuse once bone length growth has ceased. So the area that had hyaline cartilage at the epiphyseal plate will be completely replaced by bone, and that will be an example of a synostosis. Before we end this lecture, we can't do a joints basics video without talking about ligaments. They are crucial to joints. They are associated with all joints. Simply put, ligaments connect bone to bone. So they're connecting one bone to another, and they are going to be composed of dense connective tissue, either irregular or more often regular connective tissue. And there are many different types of ligaments, but we can split them into intrinsic binding structures, such as what you have in fibrous and cartilaginous joints. So those solid sheets of connective tissue. So a sutural ligament is an example of that. Ligaments can also be considered extrinsic supporting bands. So these are going to be these are more commonly damaged. They're more clinically relevant. That's often what we think of when we think of ligaments. These play a bigger role in stabilization of a joint and limiting range of motion. So I have an illustration on the right of the lateral ligaments of the ankle. These you can see are connecting bone to bone, but they're not what's actually forming the joint inside. So you are going to have the synovial joint in that region. The lateral ligaments of the ankle are the most commonly damaged ligaments in the body. So if you think of sprained ankles, you have damage to one or more of these ligaments. And we'll spend quite a bit of time talking about some of these specific extrinsic ligaments in upcoming videos. So if you've heard of your ACL, or anterior cruciate ligament, or your MCL, your medial collateral ligament, these are going to be supporting bands that are ligaments in those specific regions. In those cases, those are specific to the knee. All right, we have reached the practice question. So typically around the age of 9 months, the right and left frontal bones fuse to form a single frontal bone. And that's what most of us have in terms of the adult skeleton. After fusion, what type of joint is this? What do you think? When you're ready, let's discuss how C, or synostosis, is the correct answer. Recall, a synostosis is a bony joint. So the connective tissue that was located between the right and the left frontal bones is completely replaced by bone around 9 months. So all of these other joints have connective tissue still associated with it, so they wouldn't be correct. Before fusion, this actually was a fibrous joint. You do have a suture there, but once you have completely replaced that connective tissue with bone, this would be considered a synostosis. All right, excellent. Hopefully you're feeling good about that, and we can move on to a bit more detailed discussion regarding these different types of joints. Thank you so much for your time and attention.